Hello, I am student clinician Luis Limeres. What is your name?
Ipka.
Nice to meet you, Ipka. Today I'm gonna be performing some reflex tests on you. If anything I do hurts, please let me know. And everything you say will be held with strict confidence. May I begin?
Yes.
Thank you. I'm gonna start performing the jaw jerk reflex. Okay, so I'm gonna need you to sit up straight. Close your eyes. I'm gonna contact with my thumb your jaw. Is that okay?
Yes.
This test is for testing the trigeminal nerve. I'm gonna be performing the bicep muscle reflex, so I'm gonna need you to put your hands like this. Okay, I'm gonna go to this side first. I'm gonna contact the bicep reflex. You're gonna close your hands, tighten your muscles, relax. And I'm gonna go to the other side. Straighten your muscles, relax. I'll be performing the brachiocadaris reflex test. So I want you to put your hands on your knees like that. Perfect. To the other hand. Now I'm gonna be performing the triceps reflex muscles. Now I'm going to be performing the patellar reflex tendon. So I'm gonna start with this side. Now I'm gonna be performing the Achilles reflex. So now I'm gonna be performing the Gendrasic procedure. So I'm gonna need you to cross your legs. Okay? And you're gonna pull your legs apart, try to separate them, but still be tight here. And I'm gonna be checking. Okay? You can relax. Now, relax, separate your legs. Now you're gonna do like this with your hands and try to pull apart while I'm gonna be testing out. So, I'm gonna be performing the visceral reflexes. So I'm gonna need you to take off your glasses. I'm gonna be performing the direct light reflex. I'm gonna start in this eye. Please look forward. In the direct light, the reason is ipsilateral pupillary contraction when light is shining in the eye. The afferent is the optic nerve 2. The integrating center is the midbrain, and the efferent is the oculomotor nerve 2. Now I'm going to be performing the indirect light reflex, so please look forward. I'm going to be putting some light in the eye that is not going to be tested, and I'm going to watch the opposite eye. Perfect. The response is contralateral pupillary constriction when light is shining in the eye. The afferent is also the optic nerve 2. The integrating center is also the midbrain, and the efferent is the oculomotor nerve 2. So now we're going to be performing the third visceral reflex. The test is called accommodation. So I'm going to show you this item and you're gonna follow all the way, always looking at the item, okay? We're gonna start. So in the gag pharyngeal reflex, in the part of the superficial reflexes, the response is gonna be gagging upon the touching of the throat, the back of the throat with the tongue depressor. The afferent is gonna be the glossopharyngeal nerve 9. The integrating center is the medulla, and the afferent is the vagus nerve. Now I'm gonna be performing on my patient the interscapular reflex. The response is drawing inward of scapula when skin or interscapular space is irritated. The afferent is going to be T2 to T7 spinal nerve. The integrating center is going to be the T2, T7 spinal cord, and the efferent is going to be the dorsoscapular nerve. And this is how it's done. So you're going to have your patient sit up straight. He's not going to have a shirt on. In this case, I'm going to ask the patient, I'm going to slide to the side your support. Is that okay?
Yes.
The other side. I'm going to be performing the abdominal reflex test. The response is going to be the umbilicus deviation to the throat side. Absence is normal only if bilateral. The afferent is going to be upper T7 to T10, lower T11 to T12. The integrating center is going to be the spinal cord, T7 to T12, and the efferent is going to be upper T7 to T10, and lower is going to be T11 to T12. So I'm going to put your hands on the side. So now I'm going to be performing the plantar reflex test. The patient is going to be laying down upside up. The response we expect is plantar flexion of toes upon choking sole on foot. The afferent is going to be the tibial nerve. The integrating center is going to be the spinal cord, S1 to S2, and the afferent is going to be the tibial nerve. So now I'm gonna be performing the lower extremities pathological reflex. First I'm gonna start with the plantar. I'm gonna do it in both sides. Now I'm gonna be performing the chiffer. I'm gonna be uppering your legs of the pants. Is that okay?
Yes.
Now I'm gonna perform the Gordon. Now I'm gonna perform the sheet up. And last, I'm gonna perform the open him. Continuing with the pathological reflex, I'm gonna be performing the ankle close. Now, can you please sit down? Sit down all the way. Now I'm gonna be performing the Hoffman. And finally, I'm gonna be performing the Trommer reflex. Can you give me your hand? Relax. The other hand. Thank you.